Hi everybody, it's Dr. Patricia Coughlin. And in today's video, I really want to get back to basics and give you a kind of map for understanding what's going on either within yourself or if you're a therapist and trying to understand your patient in a deep way. This map using the two triangles is going to be extraordinarily helpful. Sometimes I get sort of alarmed and frustrated that every therapist isn't provided this map in their training, and because they can't understand what's really happening inside of their patient, they can't help the person with that, and they stay sort of superficial. They stay in the realm of the conscious mind and focusing a lot on externals. But most patients are coming to us because they need help with their own emotional life, their own reactions, the symptoms that are showing up. So I'm going to be talking to you about the two triangles discovered by, some say Menninger, certainly Malin contributed. I think it was the triangle of conflict to the triangle of person. So let me first define these. So when we're talking about the internal world of ourselves or our patient, the triangle of conflict can really help us. At the bottom of this triangle are the feelings and impulses that have been selected for in evolution and that are characteristic of the species. This is built-in equipment. This is what we come into the world with. First of all, the capacity to love and attach. So we have loving feelings, joyful feelings. We then also feel pain and grief around loss. We feel anger and protest. And we also can feel guilt when we feel angry with people we love. So these are the basic attachment affects that again have been selected for in evolution. They provide us with energy and information, and they really are the glue to attachment. Often these feelings and the accompanying impulses in particular. So if you think about the word emotion, right, it puts us into motion. Every core emotion has an action tendency. If we're feeling love, we want to reach out and embrace. If we're feeling pain and grief, we want to cry and seek comfort. If we're angry, there's a tendency to want to lash out, protect the self, fight back, set limits, and so on. And guilt, actually, about rage toward love is connected to love. And if you can let yourself feel it, will both prevent you from doing harmful things and will help you repair it if you've done some damage. So since our feelings toward others are often very complex, they give rise to anxiety. You can have the most sympathetic, understanding, supportive parents in the world, and you're still going to, inside, as a kid, feel guilty when you feel angry with your parents who might just be doing their job, right? Saying, no, you can't have ice cream for breakfast. Or no, you can't sleep over at your boyfriend's house when you're 16 years old. They're being good parents, right? But you're going to be angry and frustrated. And since you love them, the impulse to just, run them over with the car or whatever in that moment is going to cause guilt. And very often this is happening rapidly and below the level of consciousness. And that guilt about the rage can go into symptoms, either the person suddenly becoming very anxious and having a panic attack, or suddenly falling into a depression, or getting a headache, or something like that. So symptoms and anxiety are signals, they're clues. So if we can be curious about these experiences, so anxiety, right, in relation to feelings, that's at one of the upper corners of this triangle, is just a biophysiological response to emotional threats. So if we're suddenly having very complex and even conflictual feelings, I love you, I hate you, I want you close to me, but I could kill you, this is going to give rise to some anxiety and often also to guilt, which again, if it's not acknowledged and processed, can create symptoms. So, as I said, if we can be curious about, I'm noticing I'm feeling really anxious about meeting my friend for dinner tonight. I wonder what I'm feeling that's creating or triggering this anxiety. Or if I suddenly get a headache after talking to my brother on the phone, again, I might want to ask myself, what am I actually feeling toward him? And can you identify and gain access to the emotions that are underneath and giving rise to that anxiety and those symptoms? And if these symptoms are persistent and you're not able to get to them by yourself, you might need some help, because the third corner of the triangle are the defenses and the avoidance strategies that we use to avoid these anxiety provoking and guilt inducing feelings. So, if we can't gain access to them ourselves, we might need some help to get through that. And yet again, many therapists have not been trained in how to understand these internal emotional conflicts that get triggered by events in life. And they, like their patients, often confuse a trigger, for example, with a feeling. So the patient might say, I feel betrayed. Betrayed is not a feeling. The question is, was there some betrayal? Is that what happened? Okay, that's a trigger. That's what happened. I was betrayed by my boss. And so then the question is, what are you feeling towards your boss? But many therapists don't make this distinction, and they go on, talking about how the boss betrayed you and so on and so forth, and it's not often very helpful. Or they might confuse the feeling with a defense, right? So you might ask, well, gee, how do you feel towards your boss? And the patient might say, well, I feel he's really unfair. And I feel that he actually prefers my colleague. And I feel, but really all they're talking about are thoughts and judgments, right? This is actually a way to avoid feelings. But again, if the therapist can't make this distinction, right, between the feeling and the defense, they're not going to be able to help you. So I hope, again, whether you're just, a regular human being or a therapist, that you can find this triangle very helpful so you can identify and distinguish between core feelings that, again, are built in, the anxiety that sometimes is connected to those feelings and impulses, and the defensive maneuvers people are using to avoid them, because those very defenses are often responsible for the patient's presenting complaint. So if a patient is just stuck in their head, ruminating and obsessing, they can't sleep, right? This is the result of excessive defenses against their feelings. And so by understanding that, if you can help them to get to those feelings instead of staying in their head, you're going to be able to help them. So I hope this is helpful to you. In the next video, I'll talk more about the triangle of person, so that you can understand the links and the repetitions between unresolved feelings and conflicts from the past and what's getting played out in the patient's current life, and also often getting repeated in the interaction with you as the therapist. So let me know if this is helpful, and I'll see you soon.